Welcome to Dental Talk 360. We are a team of 4 dentists who are going to be speaking to you a little bit about dental topics and how we can make them more accessible and more interpersonal to our patients. In today's topic, we would like to focus on whitening. I get many questions from patients about whitening and different options in-house in the dental office versus over-the-counter whitening, and who is a good candidate for whitening. There is so much to talk about with whitening. And primarily, I think that a lot of patients don't understand the difference between whitening outside the tooth and that you can actually whiten inside the tooth. The difference in stains actually really is important, because if a patient only has staining outside the tooth extrinsically, then they are excellent candidates for toothpaste, for example, or an abrasive material that can remove outside staining, versus intrinsic, where hydrogen peroxide, the active ingredient in whitening material, actually works to whiten the tooth from the inside. So let's talk a little bit about whitening materials and the different whitening regimens that we recommend in office.
Some of the whitening products that are available out there in the market, it's vast. There are different products that cover different types of staining, different types of issues patients want to take care of. So there's one of the products that I use all the time in my practice is Core Whitening System, spelled Korr. It's an excellent product. I've been using it for over a decade at this point, and it's used in-house and also outside the office. So it's great because it combines both. And it doesn't use that dental light that most places have, which all it is a heating lamp, which causes the bleach to go in there and whiten your teeth faster. But that has a consequence of causing patients hypersensitivity or tooth pain, right? So where in anything we can avoid is that light as much as possible. And I find that with products that don't use that light, it works just as good and it causes less sensitivity to the patient. The beauty of that core product is that it can cover patients that even have tetracycline staining. When they take antibiotics when they're a little kid, such as tetracycline, it can cause pretty much a grayish or yellowish candy corn effect to their teeth, which is embarrassing for some people and they want to take care of it. This whitening system at its highest percentage can treat those in some cases. Obviously, there's many cases where they will still need to have veneers or something else to restore their teeth, but it's a great option. And it's done in-house by either our hygienists or our practicing dentists, which are able to then protect your gums so that your gums don't get irritated. That's one situation. I'm going to piggyback into it now with Dr. Sanchez. We live in Miami, so there's a lot of places now that offer whitening in the mall, and they're non-licensed. So tell us about that, and then we could go back into...
Okay, so I wanted to first talk about the different types of whitening. So we're going to be talking about the in-house versus, which means in the dental office, to at home, so meaning that you do it at your house. Regarding, you have different things like the strips that you buy over the counter, and then you have the products that we have in the office. So the products that we have in the office, you cannot buy them. So you got to be licensed in order to get them. They're higher concentration of hydrogen peroxide. The ones that you get at home, they're lower concentration. You can buy them over the counter, or sometimes we can even prescribe them to you. The places, the whitening bars that we see now around, they are not licensed, so they are not able to get that higher percentage of hydrogen peroxide to whiten your teeth, but they do throw the light, which makes it look real cool. But it doesn't really do much. It is. Essentially, you're paying for something that you can actually buy it off the counter. Now, talking about sensitivity to different things, I just want to get some data out. The in-office treatment versus the in-house treatment, it's the same. At the end of, if you follow the right protocol, after 2 weeks, you're going to achieve the same results. Why do we recommend sometimes in-office treatment with a higher percentage, and we like to combine it with an in-house that you also do? So you're going to be doing both at the same time. When we have the light or the one that we do in the office, it just gives you essentially one treatment of in office is equivalent to 2 weeks of you whitening at your house. So for patients to get them motivated, we tend to do these whitenings in the office because you get to see that result right away. you start getting motivated, and then you start using and really using the trays at the house, so you achieve that maximal result versus just doing it at the house. You do it a couple of days, and nowadays we want the results we want now. We don't want to wait. So patients get demotivated because they're like, oh, it's not really doing anything, and also it's very patient compliant. So you need to actually be compliant. So the in-office treatment will get you started with that. You start noticing the results, and then you're more likely to follow up and actually do the whitening in the house. Okay. So
Dr. Bart, what are your recommendations for, let's say, a patient that is getting married that cover different types of staining, different types of issues patients want to take care of? So there's stain. What are some of the treatment options for whitening that you recommend so they could have that beautiful, enhanced white smile for their wedding photos?
Yeah, I mean, for me, I think the in-house treatment is the best and the most effective because it's under the control of a licensed provider. Also, too, if there's sensitivity issues, there's some accountability. So if you whiten your teeth and you have sensitivity, it becomes a challenge because now you become the patient and you go out to the dentist and you explain your situation. Whereas if you do it in-house, we can control the modalities. If you start to feel that sensitivity, we can take out the active ingredients and then we can apply desensitizers to the areas. Also, too, when at least with all our patients, we take a lot of photographs so we can document the case well. So you say, patient so and so, you came in, your teeth were D4, and now you are a A3.
And those are just the tabs that we use to
The shade colors,
the shade
yeah.
colors, right? So that's the doctor or your dentist or assistant will take photos with a tab that has different colored teeth, and that's how we kind of document how far you've gotten in your whitening process,
Exactly.
and where you want to go, essentially.
Yeah. So it's interesting because some patients have this idea of toilet bowl white that they want in their mouth, but the chemistry of their teeth, the enamel, won't allow them to get that white. So
Agreed.
we can get it whiter than what they started off with, but we may not be able, the expectations have to be realistic. So that's why we like to document and start with a certain shade, and then typically we can go anywhere between
2 to 3 shades, maybe even 4 whiter.
And everyone has their own threshold of whitening. I think also it's really important to touch on the in-house whitening requires more of an intricate application. And a lot of the times, patients don't realize that we have a process before applying the whitening where we block out your gums. And that's a very crucial, important part. Also, not only just in office, but also for at home. And that's the difference between doing a crest white strip versus getting an actual customized tray made where your gums are not going to be exposed by this whitening material. Another really important thing to consider is if there are any areas of your teeth that have recession or chipped, those are areas that are weakened and more susceptible to becoming sensitive from the whitening material. So when you go to a CVS or Walgreens and you're getting crest white strips, those are not allowing you to have a more intricate application of the whitening material, and it's also going over your gums frequently and causing burning of the gums. While it's reversible, it's definitely going to cause you harm in the short term and could be very painful as well.
One topic we need to talk about is when patients have resins or fillings in their front teeth and they're bleaching. Those resins tend to not bleach, right? So now a patient's walking around and they have a lighter tooth on top and a filling that's darker on the bottom. That's something that needs to be taken into consideration when your dentist is looking at you and evaluating you for whitening, is that those restorations are either going to be replaced later on or taken into account, meaning tell your patient in advance, be like, hey, by the way, you have these fillings that are visible that are going to get darker now that we're going to whiten your teeth. Especially if they have also veneers that are made out of porcelain, because the bleaching can directly affect your veneers. Am I right, Dr. Sanchez?
It does. It doesn't. It's not going to whiten your veneer, so your veneer is not going to become whiter. But it does cause a change in the surface roughness of the veneer, which reduces it can take off the gloss essentially, so that that nice appearance of the veneer. So it can look a little bit more opaque.
And that's proven through research, right?
Yeah,
we have
this
research
is all
articles.
we have research articles on it. So so essentially, you have to let your doctor will know if you have porcelain. And then, we have to know also like what are the modalities why we're going to do some whitening. So most people come in, they have a big event, they have a wedding, they have things like that. So they want to whiten their teeth. Another option is whenever they're getting a smile design. Sometimes your teeth are too dark. And in order for us to create enough room for the porcelain to not show that
The darkness of
color
it.
of the tooth, we have to sometimes remove even more tooth structures. Sometimes what we do is we whiten the patient. After whitening, you always have to wait about 2 weeks for that tooth to get that final color, because it's going to become lighter and then it's going to go back a little bit dark. So it takes about 2 weeks for that process to happen. Also, can you tell us a little bit about what it can do with the bonding also? Because people that want to get restorations done, what are your recommendations that you personally do whenever?
So normally in a case where you're going to do let's say veneers just up top and not on the bottom, let's say their normal bottom teeth are really healthy, but they want to enhance their smile and they want to get lighter veneers up top. I always tell patients start the process before we do anything and wait a minimum of about 2 weeks before we take any final records on you as far as shade. Is that something you recommend as well, Dr. Santos?
Yeah, definitely. Because also too, after you whiten the patient and you actually deliver the veneers, there will be a rebound effect. So as soon as you deliver the veneers, 2, 3, 4 months down the line, they will get slightly darker than what you originally started off with. So just FYI out there when you
And
do
that's
this.
normal. And a lot of patients will also say, Doc, why am I having these cloudy effects on my teeth? And that's normally naturally a part of the bleaching process because it is bleaching you from the inside out. So you're going to get blotches of white around the teeth, especially right after they're done. Right, Doctor?
Yeah. And a lot of patients also are afraid about sensitivity after. That's a very common question I have. And there's ways to prevent and manage it. So I recommend at least 10 days before the whitening to use a Sensodyne toothpaste. During your in-house treatment, typically your dentist will place some potassium nitrate, which is a desensitizing agent, and that's going to go over your teeth right after the whitening process to help decrease the incidence of sensitivity. Another thing that I like to do for my patients is give at least 600 milligrams of ibuprofen right before the procedure. It's common for sensitivity to occur within the first 24 to 48 hours. And so taking ibuprofen another time during that interval is also very common and recommended. Also, a lot of patients don't realize what can stain their teeth after. So you guys want to talk about what you recommend and based off your experience with whitening?
Heavy coffee drinkers, red wine drinkers.
And you can drink coffee through straw.
Smoker.
Correct.
At least.
Smokers. So
Yeah.
if you're having coffee, drink out of a straw if possible, and always rinse your mouth out with water afterwards. Normally what I'll tell patients is if it stains a white t-shirt, don't drink or eat it for about 2 weeks in order for your teeth are porous, and the whole point of whitening is that peroxide will open that pore wider and then it'll bleach from the inside out. So meaning now your teeth are like a sponge.
That's what causes
So-
sensitivity in the beginning.
Correct.
That's why
And-
it's normal. Yeah.
And absorbs, right? So if you're drinking a lot of red wine, I'll tell patients have white wine, for example. And if you're having coffee, drink out of a straw when possible, and always, most importantly, rinse your mouth out. With smokers, they have to be very cognizant that if it's their habit, that smoke will cause your teeth to maybe take a yellow or a tar stain. So being conscious of that in that process for those 2 weeks is critical to avoid them now absorbing stain that they didn't want to have to begin with.
Yeah.
And also, what is your what are you guys' opinion regarding? Because patients come in and they want to have whiter teeth, and then the main thing is that they think they're gonna get one whitening and be done with it. And I've gotten whitening and it goes right back to the same colors after
Yes,
time.
yeah.
Up to 6 months, you have a good chance of keeping that. What I always tell patients, I don't know about you guys, so we'll hear it from you, but I always tell them that this is something that you're gonna do in 1 year at least 3 to 4 times. If you
Yeah.
want to be serious about it, you
whiten
really
once a
want to
month.
whiten it,
Yeah.
you have
Once a
to
month.
keep it up because you're not going to maintain it.
Maintenance is necessary. Your at-home care is necessary to take into consideration.
And that's important too when they're doing those restorations, right? So I'll have patients that want to be hyper white. And I'll tell them we need to be realistic if you're going to keep up with this in the macro, meaning long term. Right? So if you are going to whiten 3-4 months every time, okay. But if it's something that's not realistic to you, or you got hypersensitive from the beginning and now you don't want to do
Right,
that,
not everyone's meant
maybe
for
it's an
it.
option that you shouldn't consider, right? Maybe you should stick to a more natural looking tooth shade, right? And smile, especially if you're not going to keep up with it. So it's important to understand that you have foods and drinks that'll stain your teeth, acai, pomegranates, red wine, coffee. And you also have to, if you're going to start the whitening process, maintain it, because it's not going to last forever. It will rebound within a period of 2 weeks or so into a normalized color. And then after a month or two, it'll go back to kind of like where you were, especially if you keep those same habits, which most people will have.
Yeah, and if a patient never whitened their teeth before, this is their first time, I always recommend at least going to your dentist one time and asking about an in-office treatment, because you can also get an exam, a thorough exam, and see if you are a good candidate, or if there are any teeth that might not get white, if there are any teeth that shouldn't be whitened because of recession or chips in your teeth. So it's really important to consider those factors as well. Maintenance for whitening can vary. My recommendation is usually one professional whitening every 4 to 6 months, and then you can maintain it with an at-home, which your dentist should give you when you get your in-office whitening. The at-home whitening can be used as frequently or as infrequently as you want. Right after your whitening treatment, you can definitely use your professional whitening, or I'm sorry, your at-home whitening every day for the next week after your professional whitening. That can sometimes get the patient to an additional shade, but it all varies. So just try to get the whitening done for the first time with your dentist to just cover all bases and learn about the whitening system as well.
And to get a little bit more motivated too, because you're gonna see a big change. And then just keep the in-house whitening. You get your strips. There's many different strips. You don't really need to go super expensive on it. There's many strips that we recommend, and that you can use them in the house, and that long term is gonna give you a good result. But you just have to be motivated to do this.
I always tell the patients, your mileage may vary, because if you start the day off with coffee, you eat a hot dog, mustard, ketchup, and you end it with an espresso martini at the day, your teeth are not going to be as bright and white as they should be. Whereas, if you go to the gym and you want to work out and do this routine, and then the same thing, you're not taking care of maintaining, your regimen, then you're not going to be as cut as what you'd like to look like. So lifestyle changes for prolonging the whitening
And
effect.
age is a factor too. As we get
Yes.
older, teeth will get darker. And why is that? That internal portion of your tooth that's your nerve tends to shrink a little bit, causing the inside part of your tooth, or the dentin, to now be bigger. Now they get yellower teeth or darker teeth. So that's when they start coming in more and asking questions about doing bleaching.
Yeah, and those types of teeth can't really realistically go to a bleach shade. And those are instances where if the patient wants bleached teeth, then you have to consider other alternatives.
And that's why it's important to get that initial checkup, because you might have gotten hit as a kid in one of your front teeth, and now your nerve is no longer there, or it's calcified, as we say, meaning that it shrunk completely. And now that tooth is going to be very difficult to bleach. So it's important to get an assessment by your dentist in order for them to really look at your whole mouth in order to give you the correct bleaching protocol to give you the best.
Exactly.
And I also I wanted you guys to elaborate a little bit more, since you touched the subject of a tooth that got hit, died out over the time. Because a lot of patients, I get them that they always ask me, if I get a root canal, is my tooth going to go black? So in my personal opinion, from my research, generally speaking, this happens to teeth that have been in some sort of accident. Why? Because it's been a slow process since that tooth died, that all these blood residues, the tooth is a nerve, it has blood, and all these blood residues is what actually causes it to get this color change. It's not the same whenever you get a root canal right away because of something happened, you have an infection. This tooth is being treated in a short amount of time, so it's less likely for this to happen. But we do have other modalities like internal bleaching that we can use to actually lighten this tooth, and I've used it in many patients.
If they are root canal.
If they're
Right.
root canal,
Yeah.
right?
Yeah.
Yeah, of course. That's the
If
main
they are
thing.
root canal. If
That's the
they're
main
Yeah, from
if
the
they're not
inside
root
out.
canal, then it becomes very difficult. So definitely bleaching from the inside out, or a walking bleach, as they say, that's done normally by an endodontist or a dentist that knows how to do that procedure, because it is technique sensitive. and they got to protect everything there in order to make that work. And it is actually a very good, viable option for somebody that has a dark tooth that turned pink or dark, if you will, from a trauma.
And super conservative.
And it's super conservative and it works great. However, like I said, that is only when someone has a root canal done.
No, correct. This needs to be root canal teeth. It's mostly teeth that have been through some sort of trauma.
Yep.
So meaning that you've been probably going with your tooth for many years and you realize it's dark, you don't even know what's going on. And then your dentist takes an x-ray and then you have an abscess and you're like, I never had any pain, never had any issue. So this was a process that happened over many years. So this tooth died in your mouth, all these blood residues are there, you end up getting a root canal. You have to know how to do this procedure. Like Dr. Freddy said, it's not it's technique sensitive and it's not something you're gonna get at a whitening bar. But they will whiten your tooth from the inside out. And sometimes it solves a lot of the issues. Sometimes you don't even have to do a whitening on the outside. It's just mainly on the inside.
And in the end, it's really just a matter of us sharing with our patients the importance of having their checkups, right? And coming into a dental practice, making sure that a dental clinician, a licensed professional is looking at your teeth, assessing your overall dental health in order to give you the best options, whether it's an in-house bleaching or an at-home bleaching or an internal bleaching, depending on your situation. And that way we could give you the best result with the least invasiveness that'll cause you the less pain and give you the best result possible for you. It'll make you smile, make you happy.
Exactly. We spoke a lot about intrinsic staining, and extrinsic staining is something that can be reduced with toothpaste, any abrasive material. So a lot of patients don't know this, that toothpaste that say and brand tooth whitening or whitening toothpaste, the reason why it's branded that way is because these different brands and different toothpastes have different RDA, which is relative dentin abrasiveness. So these are different values that are assigned to different types of toothpaste basing on the amount of abrasive material inside the toothpaste. So the higher that number, the more abrasive.
So basically what we're saying is how coarse it is, right? So thinking of it like sandpaper, you have different grit, right? So it's a more abrasive grit sandpaper versus a very fine
Working on the
sandpaper that
outside of the
polishes.
tooth.
Correct.
I personally don't like this whitening toothpastes for that same reason. I know they take the stain away, but I always tell patients, it's like getting a floor and you want to clean it and you buy the sandblast and you're removing it and it looks whiter. Of course, you took a layer off. So you're going to take a layer of your teeth just to make it white. So it's better to sometimes do this intrinsic. They're going to take care of the same thing, strips or this in treatments. But these toothpastes, sometimes they're so abrasive that they actually end up damaging your tooth.
After daily use, it could, yeah.
Correct.
Such as charcoal,
Prolonged
which has been very popular. So it'll work great the first 2 times, and then after 2 years, they start saying, "Why are my teeth yellow?" And I'm like, "Well, you just removed all your enamel. You basically brush your teeth with
charcoal's
the most
marketed,
abrasive thing."
Charcoal's marketed as something that whitens your teeth intrinsically, and it doesn't.
It's not true.
It's
And it's
working
also
as an-
antibacterial.
Yeah, it's
And
not.
It's really not antibacterial. It's not antiviral. All these things that they say about charcoal,
There's just insufficient evidence on it.
there's no evidence on it.
If anything, it works as an abrasive material, and that's where this marketing came from.
And microscopically, what you want to see is a circular silica when it's doing the whitening, such as a Sensodyne pro-enamel with whitening. It's not a sharp abrasive. It's circular in nature, spherical, which means it comes off easily. It's not going to cut into your enamel and remove it. So that's why products like pro-enamel Sensodyne with whitening, when it's truly an extrinsic, or you just have external staining, is a great product for that. But when you're going into a charcoal toothpaste or any of these very, very coarse baking sodas, they could cause problems long term by removing your enamel. And there's so many options when you go to, like, say, Target, that most patients, sometimes I'll stand there in an aisle and I'll look and people are just trying to figure out what it is that they're going to get. And there's a lot of options out there. So being educated on that is very important. So it's a great topic to talk about.
Yeah, the charcoal toothpaste, I recommend it in your trash. So that's my main recommendation.
Well, this is very informative. Thank you all for your opinions and advice. Thank you guys for tuning in again to our episode on whitening. I'm Dr. Melanie Rosalia Silvestrini.
I'm Dr. Oscar Sanchez.
I'm Dr. Alfredo Arauz.
And I'm Dr. Barton Santos.